friends. I am today showing you how to diagnose with Rodoraku system and how to use different techniques of acupuncture points after diagnosing the Rodoraku imaging system. Here is diagnostic device of the Rodoraku system. This is depends on the 5 elements theory, and you must remember the 5 element theory in all time. There is first element, you can remember that wood element. In Ayurveda, it is called Akash Tattva. Wood element generates fire. And in the wood element, there are two channels of the acupuncture channels, gallbladder and liver. When there is problem of acidity or osteoarthritis or rheumatoid arthritis or uric acid, there must be imbalance of the gallbladder and liver channel, that is wood element. It may be excess. So wood element generates fire. In fire, there are 4 channels in the acupuncture: triple warmer or Sancho or triple hitter, you can say. Then heart, pericardium and small intestine, these 4 channels are of the fire element. After fire, ash is generated, ashes, and ash is equivalent to earth. Fire generates earth, that is stomach and spleen. When there is digestion problem, there must be problem of the earth element. It may be weak or excess. In the earth, you will find the metal, that is lung and large intestine is having the metal element, and when metal is excess, you will find the lung problem, that is asthmatic attack or skin problem, large intestine digestion problem, constipation. And when the metal is heated, it liquefies. After liquefying, water element, fluidity, water element is there. Kidney and urinary bladder, it shows the water element. Metal element generates water element. After water generates, water increases wood. After water element, there is again wood element. This is the generative cycle: wood, fire, earth, metal, and water. Then destructive cycle: metal cuts wood, means metal access X, it cut the wood. Then wood's roots digs the earth. Wood cuts earth, means wood controls earth, and earth control water by dam. Building a dam, some water can be controlled. But when water flood is there, earth cannot control. So there is limitation of controlling all elements. Water also controls fire. Water extinguishes the fire. So if there is small type of fire, water controls the fire. If there is fire in the forest, it cannot control. So this type of destruction cycle and construction cycle all has certain limitation. We can treat with that points. After that, we can see the classification of acupuncture points. There are the points which are on the meridian or channel. is called meridian or channel points. There are extra points which are not on the channel or acupuncture line, meridians. Then there are certain recent acupuncture points. These are discovered by the physicians and scientists. And there are also yuan source point. Yuan source points where the maximum energy of the channel is in the yuan source point, and it is used for the chronic disease. Each channel has one yuan source point, and all these points are situated on the wrist or on the ankle. For example, on the hand, lung 9, Li4, then Si4, P7 are the yuan source point on the hand, and on the leg, stomach 42, spleen 3, then UB64, K3, P7, and gallbladder GB43 and liver 3 are the yuan source point on ankle. So here is a mistake. Lung 11 is written. Lung 9 should be there. I have corrected it. After that, we can see there are alarm points. These are the points which work as an alarm signal. Each channel has one alarm point, and in the time of the disease, the particular channel or the organ, they become red, tender, or painful. Tender means sensitive, or swell. These are useful for the diagnosis or prognosis of the treatment. And these points are move front and back shoe points that we'll see afterwards. And there are jingle points. In the medical emergency like shock, coma, unconsciousness, fits, severe headache, hyperapraxia, and in chronic disease, these points are used, jingle points. These are either starting point of the channel or at the end point of the channel. These points are, except GV26 is on the upper lip and K1 is on the foot, and all the jingle points are near the nail root. For example, lung 11, here by mistake it is written lung 11, Li1, pericardium 9, triple warmer 1, heart 9, SI1, spleen 1, stomach 45, liver 1, GB44, K1 and UB67 are the jingle points which are used in the emergency cases. Then there are tissue influencing point. There are 8 important tissue in our body. For each tissue, there is specific point which is useful for the treatment of the particular tissue. For example, CV12, it is used for the hollow or fu organs. Hollow organs means small intestine, large intestines, triple wormer, gallbladder, urinary bladder, and liver 13 on the tip of the 11th free rib. It is for the solid organ. It is influential point for the solid organs, or in China it is called a Zhang organs. Solid organs are gallbladder, liver, pancreas or spleen, lung system, heart, pericardium are the solid organs. Then UB17, it is influential point for the blood. It is on the backside. And UB11, it is useful for bone and cartilage. So in every disorder, you must use UB11. It is on the second dorsal vertebra, two finger lateral side of the spinous process of second vertebra. If there is problem on the right side, use right side of the UB11. If there is problem on the left side, means left frozen shoulder, left side sciatica, left side knee pain, you should use UB11 on the left side. Then GB34, it is also compulsory point. It is influential point for the muscles and the tendon, for the pain of the ligaments and tendons, lumbago, lumbar pain, frozen shoulder, knee pain, and also for headache, acidity. You must use GB34 points on the lateral side of the patella, forefinger below the lower margin of the patella. Then UB39, it is most useful in the bone marrow. In the bone marrow, RBCs are developed, red blood corpuscles. So you should use UB39 in the thalassemia patient. Then lung 9, it is for vascular system or blood vessel. So you can use this point for heart patient, asthmatic patient, cardiac patients, and heart related patient, BP, blood pressure patients. You must use lung 9. It is danger points for needling, so you can use it with soft laser. Ashi point and floating points. These are points have no location. It can come out at the time of the disease of the particular organ. At the time of the disease, they become tender, swell, painful, sensitive. After cure of the disease, they will disappear. Ashi points are the points where there is pain. They are on the knee, lumbar, shoulder. They are situated anywhere on the body. For large intestine, stomach 37, stomach 13, 6 is for stomach, triple warmer UB39, gallbladder GB34, small intestine stomach 39, and urinary bladder UB40 are the Ashi points for that organs. There are dangerous points which are situated over vital organs or arteries. These are dangerous for needling, can harmful for that particular organ or artery. These points are danger points. Needling must be done carefully after sufficient experience. In the laser acupuncture, these points can be treated without harm to any organ or artery. Leo connecting points are there. These points connects link between two connected channels or two same channels of both sides. These are only points which can treat a disease of the two connecting channel or channel of the both sides. Lung 7, Li6, stomach 40, SP4, H5, Si7, UB57, K4, P6, TW5, GB37, liver 5 are the Leo connecting points. Then there are distal points. These points acts on the particular organ from the long distance. These are known as distal points. Li4, it is distal point for the neck and head area, face, forehead, neck, and 5 sense organ. It is compulsory points for all diseases. Lung 7, it is distal point for the back of the head, then neck, upper back, and lungs. P6 is front of the chest, diaphragm, upper half of the abdomen, that is from umbilical to sternum notch, and from sternum notch to vertex, Li4 is there, And for backside, lungs 7 is there. And UB40 is for the low back, urogenital organs. Means it is used for lumbar pain, lumbago, sciatica, and urogenital problems and gynec problem also. Stomach 36 is used for stomach and now we start how to how to use Rodoraku points that are tonification and sedation points and element points. I will share you the screen. PPT tonification points, these are the points for used to increase the energy of the channel. Each channel has one tonification point. These points are also called as mother point, reinforcing point, tonifying points. These points are lung 9, LI11, stomach 41, SP6, H9, SI3, UB67, K7, P9, TW3, GB43, and liver 8. Sedation points, these points are useful to sedate the excess energy of the channel. Each channel has one sedation point. These points are also called as sun point, reducing point, or sedation point. Lung 5, Li2, stomach 45, SP5, H7, SI8, UB65, K1, P7, TW10, GB38, GB34, and liver 2 are the sedation points. Local points, these points are situated near the affected organ, are also known as local points. These points may be meridian points or extra points or Ahashi points. Ziegler point, these are used to treat acute diseases of the channel and pertaining internal organs. Each of 12 channels have one Ziegler point. Lung 6, LI7, stomach 34, SP8, H6, SI6, UB63, K5, P4, TW7, GB36, and liver 6 are the Z-cleft point. And there are 60 command points, 5 elements points, or 5 shoe points on each channel. All yin meridians are having all element points of from nail are wood to water, wood, fire, earth, metal, and water. This sequence you must remember anytime: wood, fire, earth, metal, and water. And all young meridians are having all elements points from nail are metal, water, wood, fire, and earth. In the construction cycle, metal, water, wood, fire, and earth. This is the construction cycle. And above, wood, fire, earth, metal, and water is also construction cycle. The yang metal at each level destroys yin element of the same shoe point level, as exemplified in the destructive co-cycle of the 5 element. Each jingle point of yang channel always corresponds to metal element, and each jingle point of the yin channel always corresponds to wood element. Hence, metal controls wood or metal destruct wood element. Yang channel controls yin channel. Same time you can say in our life, husband controls wife. Specific points and their applications. Each 12 symmetrical channel, there are 5 specific points located below the elbow and knee. They are Jing, Jing, Shu, Jing, and He. Jing means well, Jing means spring, Shu means stream, and Jing means river, He means sea. Jing means vital energy of the channel is like water in the well, and Jing means vital energy of the channel is slightly stronger, similar to spring. And Jing means vital energy of the channel is stronger, flowing like a stream. And Jing river means vital energy of the channel is flowing like a river. He means the full of the vital energy like a river flowing into sea. Yin channel on the hand and yang yin channel on the leg. Yin channel on the hand and yin channel on the leg are water element. Then next, Jing spring points are wood element. Shu stream points are fire element. Jing river points are earth element, and Hesi all Hesi points of yin channel are metal element. Here yang channel of the hand and yang channel of the leg. Here all Jingwell points are metal element of the yang channel, and all Hesi points are earth element of the yang channel. Then we must know mother son law. Mother point and son points. Mother points are used for tonifying the channel energy, and son points are used to sedate the energy of the channel. For example, lung channel has metal element, and the earth element is the mother element of the metal element. Means metal found in the earth. Lung 9 has earth element, hence it is the mother point of the lung channel. Mother point is used to increase the chi or energy of that channel when it is deficient. It is also called tonifying point. And sun point. Sun point is the point of the channel which has sun element of that channel. For example, lung channel has metal element, and water element is the sun element of the metal element. When metal is heated, it liquefies, it converts into water. Lung 5 is the water point of the lung channel. So hence it is the sun point of the lung channel, and sun point of is used to decrease the chi of the channel or energy of the channel decrease when it is the sedation point. Hence lung 5 there is vein incubable vein. Blood is taken from lung 5 and it is injected to the GB30 or gallbladder channel. It is wood element. Hence water is poured to wood element. Hence lung is sedate, means metal is sedate and wood is tonified. This is the point injection therapy for all infectious diseases. Then Horary point of the channel has the same element of the channel. For example, lung channel has metal element and lung 8 point has also the metal element, and it is the Horary point of that channel. It is also called the element point. It is used in the time of organ clock, that is 3 to 5 a.m. when the maximum flow of the energy is in the lung. Then here is mother point, sun point, Leo connecting point, and horary point of the 12 channels. Lung channel, lung 9, mother points, means tonifying point, and lung 5 sun point means sedation point. Large intestine Li11 mother point, Li2 sedation point or sun point. Stomach 41 for stomach channel is mother point, and stomach 45 is sun point means sedation point. For spleen, SP2 is tonifying point, SP5 sedation point. Heart, H9 is tonifying point, H3 is sedation point. Small intestine, SI2 is tonifying point, SI8 is sedation point. UB67 tonifying point, UB65 sedation point. K7 kidney tonifying, K1 sedation point. Pericardium P9 is mother point, that is tonifying point. P5 sun point, P3 sun point, that is sedation point. P3. P3 is sedation point. TW3 is tonifying point, TW10 sedation point. GB43 is tonifying point, GB38 is sedation point. Liver 8 is mother point, that is tonifying point, and liver 2 is sedation point. Now we come to treatment for the deficient channel or deficient metal. The rule is, there are 4 types of rules. Tonify the mother point of the deficient channel. Tonify the mother point of the coupled channel. Tonify the mother point or horary point of the mother channel or of this deficient channel. Tonify the mother point or horary point of the coupled channel of the mother channel or deficient channel. Means point to be selected as above technique when the metal is deficient. Lung or large intestine deficiency. Tonify the earth element point of the lung channel, means lung 9 tonify, or couple channel, large intestine, Li2 is tonifying point. Then tonify the earth element point of the spleen channel, means SP3 you should tonify, because the spleen channel is having earth element, and earth element should be, when earth element is tonified, metal will come from earth, means tonify SP3, tonify earth point of the stomach channel, that is stomach 36. Out of these 4, we can use for lung system, lung 9 or large intestine system Li2, or either one or 4 of these channel, these points can be used. So most effective point is that channel point, that is lung 9, when lung is deficient, lung channel is deficient, and then when large intestine is deficient, Li2 is most important. After as for supporting, you can use SP3 and stomach 36. Same kidney or urinary bladder, that is water deficiency. K7 is tonifying point, UB67 is tonifying point, and tonifying point of the mother element, that is lung 8 and Li1. Liver and gallbladder deficiency, that is wood deficiency. Here liver 8 is tonifying point and gallbladder is tonifying point. And mother channel, mother element of wood is water. From water, wood is developed. K10 and UB66 are used to tonify wood deficiency. heart and pericardium, small intestine and triple worm. Four channels are fire element. So tonify the wood element point of the heart or pericardium channel or triple warmer channel or small intestine channel. So H9 or P9 we should tonify. Si3 or TW3 tonify. Tonify the mother element of mother point, that is wood, mother channel of fire element, that is liver 1 and gallbladder 41. They should be tonified. Then wood earth deficiency, that is spleen and stomach. Tonify the fire element. Fire is the mother of earth. So tonify the fire element of spleen channel, that is sp2, stomach 41, and tonify the fire element of the heart or pericardium channel, means fire channel, that is H8, P8, Si5 or TW6. Then above are used to tonify the channel, puncturing along the direction of the channel. Tonifying means puncturing towards the channel or along the channel, and sedation means against the channel. After removing the needle, press the point, doing acupressure massage circularly towards the point. And if you want to give lesser, it should give towards the channel, direction of the channel. Means lung 9 is given towards the lung 11. This is known as the setting the mountain on the fire or tonifying the reinforcement or Boo method. Now next, treatment for the sedation. Technique for excess channel. Choose the points as follow to sedate. Sedate the sun point of excess channel, same points sun point. Sedate the sun point of the coupled channel. Sedate the sun point or horary point of the sun channel or excess channel. Sedate the sun point, horary point or coupled channel of the sun channel or deficient channel. Now points to be selected as above technique. Lung excess means metal excess. So sedate the water element point of the lung channel, that is lung 5, Lu5, then Li2, K10 and UB66. Then kidney excess or urinary bladder excess, that is water excess. Sedate the wood element point of the kidney channel, means K1, then UB65, liver 1, GB41. Then liver or gallbladder, excess of wood, means fire element, should be sedate. Liver 2, sedate liver 2, sedate GB38, sedate H8 or P8, sedate Si5 or TW5. Heart, pericardium, small intestine or triple warmer, means excess of fire excess. Sedate the earth element point of the heart pericardium channel. H8, H7 or P7 are sedation points. All are on the wrist. H7, P7. H7, P7. Sedate the earth element point of the small intestine channel or triple warmer channel, that is SI8 and TW8. Both are on the elbow. Behind the elbow, SI8 on the ulnar nerve and TW10, two finger above the olecranon. Set at the earth element point of the spleen channel, SP3, set at the earth element point of the stomach channel, stomach 45. Earth axis, spleen or stomach axis, set at the metal element point of the spleen channel. Set at the spleen channel, SP5, stomach 45, lung 8 and LI1 are the metal element point of access channel, spleen and stomach channel. You can set it SP5, stomach 45, lung 5 or LI1. Above points are used to sedate channel, puncturing against the direction of the channel. After removing the needle, do not press the point. While doing the acupressure, massage anti-clockwise from the point and laser against the direction of the flow of the channel. Means SP5 is to be treated towards 45-degree towards the SP1 direction. Okay, now the 4-needle technique. It is used here in our Rodoraku diagnostic device or Rodoraku imaging system. In this technique, tonifying and sedation points are used. Means constructive and destructive cycle is used simultaneously. Treatment for the deficient channel, now we can say, means tonifying treatment. In this first and third rule of the tonifying treatment is the same, but here the third rule is second. Tonify the mother point of the deficient point, deficient channel. Tonify the horary point, a master point of the mother channel. First to tonifying, second to sedation point. Sedate the control element point of the deficient channel. And sedate the control element point of the controller channel. Now points to be selected as per above rule. Lung or large intestine deficiency means tonifying treatment. Tonify the earth point of lung channel, that is lung 9 or LI11. Tonify the earth element point of the spleen channel, SP3 or stomach 36. Sedate the fire element point of the lung channel, that is lung 10 or LI5. Sedate the fire element of the heart and pericardium channel, H8 and P8 or TW6 or SI5. Kidney deficiency or water deficiency. Tonify the metal element point of the kidney channel K7 or UB67. Tonify the metal element point of the lung channel, that is lung 8 or LI1. Water is deficient, so fire should be sedate. Sedate the fire element point of the kidney channel K2 or UB60. Sedate the fire element point of the heart or pericardium channel P8 or H8, TW6 or SI5. Liver deficiency or wood deficiency. Tonify water element point of liver. Because the water support wood. Water sun is wood. Water is the mother of wood. It is tonify liver 8 or GB43, tonify K10 or UV66. Wood deficiency, then shaded metal means it will not destroy the wood. Shade the metal element point of the liver channel, liver 4 or GB41. Shaded the metal element point of the lung channel, lung 8 or Li1. Then heart or pericardium, small intestine, triple wormer, all these are fire element channels, deficiency of the fire. So to increase the fire, wood should supply. Tonify the wood element of the heart, pericardium channel or triple wormal channel or small intestine channel. Tonify wood element point of the liver channel. This liver 1 or GB41. Shaded the water element point of the heart or pericardium channel. Means water distinguish fire. So water should be shaded. Fire would be tonify. Shaded the metal element point of the kidney channel, K10 UV66. Metal, sorry, shaded the water element point. Then spleen or stomach deficiency, that is earth deficiency. So earth is deficient, tonify the fire element point of spleen channel. That is tonify mother element. Tonify fire element point of the heart, pericardium channel or small intestine or triple warmer channel. Shaded the wood element point of the spleen channel, SP1 or stomach 43. Shaded the wood element point of the liver channel because wood destroys the earth. So you should shaded wood to tonify earth. Now treatment for the excess channel means sedation treatment. Technique for the excess channel, choose the points as follows. First and third rule of the sedation treatment is the same, but here third rule is second. Shaded the sun point of the excess channel, shaded the horary point or master point of the sun channel, tonify controller element point of the excess channel, tonify controller element of the controller channel. Points to be selected as above techniques, lung excess or metal excess. Shaded the water element point of the lung channel, that is lung 5 or Li2, kidney K10 or UV66. Then tonify the fire element point of the lung channel, lung 10 or Li5, and fire element of heart and pericardium channel, H8, P8, TW6 or Si5. When metal is excess, it should be controlled by fire. So tonify the fire element point. Now kidney and water excess, urinary bladder or water excess. Shaded the wood element point of kidney channel, K1. K1 is sedation point and UV65 is sedation point. Liver 1 and GB41 is sedation point. Then tonify the fire element. When water is excess, fire will be evaporate the water. K2 and UV60 are the fire element points of the kidney and urinary bladder channel. Tonify the fire element point of the heart and pericardium channel, P8, H8, TW6, Si5. Out of this, you can use 1 or 2 or 4 points. Heart pericardium, small intestine, triple warmer, axis or fire axis. Shaded the earth element point of the heart or pericardium channel. H7 or P7, TW10 or SI8. Shaded the earth element point of the spleen channel. SP3 or stomach 36. Then tonify the water element point of heart and pericardium channel or TW or SI channel. Tonify the water element point of the kidney channel, K10 or UB66. Spleen and stomach axis or earth axis. Sedate the metal element point of the spleen channel, SP5, stomach 45, sedate lung 8, Li1, tonify SP1, ST2, SP1 and stomach 43, liver 1 and GB41 should be tonified. Means wood is tonified. Earth will be less sedate. Earth will be sedate. Sedate the metal element point of the spleen channel, SP5. Or stomach 45. When metal is taken from earth, earth will sedate. Now all these rules are used to in Rodoraku therapy. This Rodoraku therapy is for 73 years old. It is discovered. It is developed in Japan in 1950 by Professor Yoshio Nakatani. In Poland, it is used since 1983. Rodoraku means the line of high electrical conductivity. This is what the method creator called the lines he has discovered, which is actually overlap the meridian of classical acupuncture. In our body, there are 12 meridians, 12 major organs in which the chi flows in certain direction or energy flows in certain direction. Unless until there is no blockage of the energy or chi in our body is healthy, our body is healthy. If there is blockage of the chi in the direction of the meridian, it causes the diseases. When the blockage of the chi is removed, the chi flows naturally and easily in a certain direction of the meridian and disease is cured. This is the principle of the Rodoraku therapy. The blockage of the chi is found exactly in which organ's meridian Rodoraku therapy is, and it is removed by low level laser therapy or soft laser therapy. Advantages of Rodoraku therapy: it measures and quantity the normality and abnormality of each meridian. Advise exact point of the individual to treat out of 2000 acupuncture points of the body, that is left and right side, including extra points. Not only present disease are treated, but also treat the hidden diseases which may be possible in future with this Rodoraku therapy. It does not need to take separate treatment for each diseases. If the patient is having 3, 4, 5 diseases, it can be treated in single setting. In traditional needle acupuncture, there are certain points are dangerous and prohibited for needling. These points are treated with soft laser or low level laser. Treatment of the acupuncture with 10 to 20 needles takes place about 40 minutes, whereas in the laser Rodoraku laser treatment, 60 to 90 points are treated in 10 to 15 minutes. Rodoraku laser acupuncture is having lower risk, higher efficacy of treatment, decrease the time of future treatment and effective for longer time, decreases numerous expensive medical investigation fees. It accurates and faster, just take 3 minutes to balance the body. Diseases of the spine, joint, elbow, shoulder, heart blockage, uterus, kidneys are treated without operation. No side effects. Effective for pediatric and geriatrics, means for infants and for older patients. It gives the balance in physiological and psychological parameters of the patients. This is the great regulating anatomic autonomic nervous system. Electropuncture computerized instant diagnostics of functional state of an organism. Sports performance optimization is the valuable application of the Rodoraku diagnosis as it helps to balance the body's energy flow and enhance the sports ability. It is great regulating autonomic nervous system. The function of the autonomic nervous system is as it controls, autonomic nervous system controls all internal organs. It controls the secretion of the digestive juices, assimilation and elimination, controls the circulatory system. That is with sympathetic nervous systems are excited, the blood vessels contract. When the parasympathetic nerves are excited, when vessels are dilate. The reverse as seen in the coronary artery. Rodo autonomic nervous system control the metabolism. It is also related to the resistance of the tissues. Autonomic nervous system influence on the WBC and RBC and platelets contained in the blood. When the sympathetic nerves are stimulated, an increase in the white corpuscles is seen, while the stimulation of the parasympathetic nerve results in an increase in the red corpuscles. It influences in the muscle tone, direct and indirect control of the endocrine system. It controls of various reflexes necessary to maintain the balance of the function of the human body. It controls the defense mechanism of the tissue against the microorganism and internal and external obstructions. In fact, almost all functions required for well-being of the living things are controlled by the autonomic nervous system. Thus, the autonomic nervous system is sometimes referred as the life nerves. It may be said that the majority of the cause of the foremost internal cause of the disease is abnormality of the function of the autonomic nervous. Therefore, with the regulating treatment of the autonomic nervous disease have better chance of the being cured. While the importance of the autonomic nervous system is well known, and the fact that therapeutic method is related to the regulatory treatment of the autonomic nerves is lacking, may be blind spot in the modern medicine. In simple way, autonomic nervous system is the system regulating system that we cannot control liver, kidney, heart, all organs of the organism. So we can control it by stimulating the supply nerve to that organ. Now here is how to check the Rodoraku points. On the wrist, in the Rodoraku, there are 6 points on the wrist and 6 points on the ankle. And they are named as on the hand H1, H2 and H3, H4, H5, H6. H1, H2, H3 are the on the palmar side of the wrist, and H4, H5, H6 are on the dorsal side of the wrist. H1 is lung 9, H2 is P7, H3 is H7. H4 is SI5, H5 is TW4, and H6 is Li5. And first, we should check On the left hand, all these 6 points. Then on the right hand, all these 6 points. Then on the ankle, there are 6 points. These are called as foot points. F1, F2, F3, F4, and F5, F6 are the 6 points of the foot. F1 is FSP3. SP3 is the F1, first checking point of the leg or feet. Then lever 2 is the second checking point of the feet. Then K3 is the third checking point of the K4 is the third checking point of the feet. K4. Then F4, UB65 is the fourth checking point of the leg. Then GB40 is the fifth checking point of the foot. And F6, that is stomach 42, is the sixth foot point for checking of Rodoraku treatment. First, you should check of the left feet as per order F1, F2, F3, F4, F5, F6, and then check right leg F1, F2, F3, F4, F5, F6. Then how to open? Here you are given the link. Open the link in Chrome and write your username, then password, then sign in. Then this type of screen will be there. Here is you should write H1 lung 9, then H2, H3, H4. All you should use tab button. Then cursor will go to second block. After that, use foot point F1 to F6. Then save. After that, you will find the analyzed value. Here are the 43 is the average of 24 points. And for 43, here is 58 is excess, 22 is less. Here left right is imbalance. Here H5, that is triple warmer, both are negative, left and right side on the hand. And here F3, right and left side are excess. So here we should use sedation treatment. Here we should, for K3, we should use tonifying treatment. Then here you find possible symptoms and treatment to be given. Here we can say liver, spleen, large lymphatic system. Here both sides are imbalanced. You should use TW10, stomach 36, TW2, and UB66. TW2 and UB66 are tonifying treatment, and TW10 and stomach 36 are sedation treatment. Next on the feet, kidney both side positive. So we should use tonifying points of K7 and lung 8, tonify, and sedation treatment K2 and P8. Then here is the chart, sedation point and tonifying point. Here all solid circle is tonifying points and hollow circle is sedation points. And here is for left right imbalance, Leo points are given. And with this, after that, you can use move front point. For heart deficient or tonification, use REN 14. For pericardium, use REN 17. For large intestine, use stomach 25. And Bakshu point same. If there is deficient in liver, use liver UB 18 at the ninth dorsal vertebra. With this chart, you can use. Then here is the selection of the acupuncture points as traditional method. Use of the affected channel points, important points on the channel, use of ion source point or for chronic disease, distal points for specific area, use of influential point for specific tissue, jingle points for medical emergency, specific points for specific diseases, analgesics points for relieve pain, sedation points for the psychological disorder, sedate the body and mind, use of compulsory point, use of immunity increasing point, use the local points for knee pain, lumbar pain, local points you should be used, use of extraordinary points, tender points, hashi points, alarm points, use points as per the nerve supply, application of Leo connecting points to remove the imbalance between the two paired organs, application of Z-cleft point for acute disease, application of confluent point for extraordinary channel, use of tonification and sedation point, use of auricular, face, nose, hand, foot, microsystem acupuncture system, microacupuncture, use of move front and back shoe points, and use of scalp acupuncture. Here are the yuan source point. Lung 9, Li4, stomach 42, SP3, H7, SI4, UB64, K3, P7, TW4, GB40, liver 3. Here are compulsory points. On the head, GV20, on the hand, Li4, Li11, TW5, lung 7, P6, H7. Compulsory point on the leg, stomach 36, GB34, K3, SP6, SP9, UB40. Analgesic point, Li4, stomach 44, SP6, K3 are the analgesic points. Sedation point, GV20, H7, P7, UB62, extra 789. Immunity improvement point for infectious disease, Li11, stomach 36, GV14, SP6. Specific points for the specific diseases. For the cough asthmatic attack, REN 22, lung 6, REN 22 or CV22 is in the sternum notch, abdominal distension, stomach 25, stomach 36, stomach 25 is 3-finger lateral to umbilical. For cough and sputum, use stomach 40 and CV12. For constipation, stomach 25, TW6. Epilepsy convulsions, GV26, DO26 or K1, extra 1, liver 1, Li4, diarrhea, SP6, SP9, stomach 36, CV6 or REN6, SP4. For fever, GV14 or DO14, governing vessels or DO, Li11, Li4. For hiccup, P6, UB17, stomach 36, frequent urination, use REN 2, CV2, SP6, and UB31 and UB32. Frequent motion, GV1, UB57, stomach 36, SP4. Insomnia, GV20, H7, extra 8 and 9. Chest pain, CV17, P6. For edema, REN 5 and REN 9. REN 5 is 3-finger below the umbilical and REN 9 is 2-finger above the umbilical. SP6 and UB20, these 4 points for swelling. Urticaria pruritus allergic, UB16, SP10 is specific points for allergy, SP6 sneezing extra 1, Li20, GV25. GV25 is on the tip of the nose. Polyhydrosis, S6K7 Li4, and P8 and K1 also used. Vomiting, nausea, P6, stomach 36, shock, GV14, CV4, P6, P9, CV8 for moxibustion. CV8 is on the umbilical, inside the umbilical. You can use laser also. As per doctor's experience and patient symptoms, for high fever, GV20, Li11, Li4, and 12 jingle points bleed. Fever due to yin deficiency, P6, P7, H5, SP6, K3, cold extremities and fainting, K1, GV25, 26, CV1, heart attack, P6, stomach 36, GV20 points to be moxibustion. CV6, CV4, prick needle and bleed the points for 2 drops at extra 30, means on the tip of the fingertips. Night sweating, H6, K7, Li11, Si3, dream disturbed sleep, GB31, UB15, H7, P6, SP6. Neurasthenia and weakness, CV6, GV14, CV4, GV4, UB43, stomach 36. Malaria, P56, Li4, extra 24. Indigestion of the infants, extra 29 and stomach 36. Anemia, UB17, UB20, GV39. In anemia, you can give the injection of B12 to P5 or P4 or 3 finger below the umbilical. Use of combination of the points. Disorder of heart and chest, P6, SP4. Disorder of head and face, Li4, stomach 44, Si11. Combination of interior and posterior points. Disorder of the chest, CV17, UB14, backside, UB15. Disorder of stomach and large intestine, stomach 25 on the abdomen and UB25 on the waist. Combination point of the left and right. For example, migraine, use the right side can be treated, points on the left leg, GB34 and GB43. For facial migraine on the right side, means headache on the right side can be treated, points on the left leg, GB34 and GB43, or Li4 also used on the left side. Facial paralysis on the left side is cured by selecting the point Li4 on the right hand. Combining external internal relationship of the channel means paired channel, or external yang and internal yin can be used simultaneously. For example, stomach disorder, stomach 36, stomach 34 of the stomach channel combined with SP4 and SP5. Or large lung disorder, lung 5, 7 and lung 9 in the lung channel combined with Li4. That is, lung is combined with large intestine channel. Combine in local and distal points. For example, pain in the gastric region, local points CV12. Stomach 21, UB21 are the local point on the backside, with the distal point stomach 36, P6 and SP4. This is area, local points and distal points. Vertex, On the vertex, GB20, GB20, extra 6. Distal point on the hand, Li4. On the leg, liver 3, K1. Forehead, on the forehead, extra 1, GB23, stomach 8. Hand, Li4, stomach 44. On the leg, stomach 41. Temple area, GB8, 20, extra 2. Distal point, TW5, GB41, 43. Neck, local point, GB20, UB10, GB14. Distal point, SI3, UB60 and UB60. 2. For eye, UB1, stomach 1, GB20 and GB16 are the local points. Distal points, Li4, Si6, liver 2, SP5. Like this, you can see here up to lower extremities. Now, application of 8 extraordinary channel and confluent point. P6, SP4, heart, chest, hypochondriac region. These are most effective points in Rodoraku system. Si3, UB62 for the neck, shoulder, back, inner canthus of the eye, contralateral side of the ear disease, mental disorder. For the deafness, Si3 and UB62 I have used. For indigestion, heart problem, P6 and SP4 I have used. TW5 and GB41, temporal region and outer canthus of the eye, and for migraine use opposite side. Lung 7 and K6 for throat, lung and chest infection. Points according to the innervation of the nerve. Innervation in the same dermatose, same myotones, the pathway of the nerve. For example, sciatica may be selected in the segmental neurological disorder. For the example, trigeminal neuralgia, sciatic pain, herpes zoster, cervical spondylosis, intercostal neuralgia. We can use the points on the nerve. For the disease of the head, trunk, upper, lower limb, internal organs, selection of the points may be made in the area supplied by the spinal nerve plexus, appropriate nerve trunk. For example, extra 21 points are very useful on the spine. C1 to C4 for headache disorder, C1 to C7 for neck disorder, C3 to T6 for hand and shoulder disorder, scapular region. For chest disorder, T1 to T7 means thoracic first vertebra to seventh vertebra. Abdomen disorder, T8 to T12 and L1 to L5 for lower abdomen. Lumbar disorder, T8 to T12 and L1 to L5. Lower limb and gluteal disorder, L3 to L5, S1 to S2. Genitourinary disorder, S1 to S4. And here is the organ clock. Means 3 to 5 a.m. The energy is in the lung channel. At that time, you should use lung 8. And opposite side, urinary bladder, UB66. You cannot use at the time 3 to 5 a.m. You can use 3 to 5 p.m. So this is the after that large intestine, 5 to 7 o'clock, 7 a.m. 7 to 9 a.m. energy is in the stomach channel. 9 to 11 a.m. 9 a.m. to 11 a.m. the energy is spleen channel. Then 11 a.m. to 1 p.m. energy is in heart channel. Small 1 to 3 p.m. small intestine, 3 to 5 p.m. urinary bladder, then kidney, pericardium, triple wormer, gallbladder, liver. Here is with this organ clock we can use moon noon midnight law or midday midnight law. Noon midnight law or midday midnight law. Suwu. The treatment according to the organ clock also corrects imbalance of vital energy involving the organ channel, diametrically opposite to organ clock. Treating the urinary bladder channel 3 to 3 p.m. The point use UB66 will have opposite therapeutic use influence on the lung at 3 a.m. Same if sedate UB66 3 to 5 p.m. lung rate will be 25 at 3 to 5 a.m. If you sedate 5 to 7 p.m. LI1, it will 25. If you sedate K19, if you sedate K1, pericardium, K10, horror point. If sedate K10 at 5 to 7 p.m., LI1 will be 25 at 5 to 7 a.m. If you sedate P8 at 7 to 9 p.m., stomach 36 will 25 at 7 to 9 a.m. If you sedate H8 at 11 p.m. to 1 a.m., GB41 will 25 at 11 a.m. to 1 p.m. If you sedate SI3 1 to 3 a.m., liver 1 will 25 1 to 3 p.m. For this Rodoraku diagnostic device, we should use 4 to 5 points. That Rodoraku imaging system you should have. Online software link you should take. Then username and password will be sent on your laptop, computer, mobile, Android or MacBook. For detail, you can contact Amey Sakhare 9970912189 and Dr. Meghashan Sakhare 9890195059.